Hello and welcome to West Leederville Private Hospital. This information video will show you the processes that we have in place to keep our staff, doctors and you, our patients, safe until the pandemic is behind us. Even if you have visited us before, we would appreciate your attention and participation in the process that we call the 6 steps to surgery.
Step 1. EAdmission. By now, you would have already received your patient information booklet. It provides useful and important information about the hospital and what to expect during your time with us. It also contains important information relating to our COVID management requirements. Your journey begins at home by completing your EAdmission. You'll receive a link to do this ahead of your surgery, so you have plenty of time to tell us about you. We ask that you complete this at least a week before your admission date to help minimise any delays or additional waiting times before you go for surgery. The EAdmission asks you questions about your health and wellness coming into hospital, as well as any medications that you might be taking. It's useful to have your Medicare card and private health insurance details handy, as these may be needed to complete your EAdmission. Step 2. Download the Service WA app and link your services. By downloading the Service WA app and linking to your COVID vaccination certificate, if you have one, you'll save time and effort when you arrive at our check-in counter. Step 3. Pre-admission screening. The next step in the process is a phone call from our pre-admissions nurse, who'll provide you with your admission time, the time to start fasting, and we'll go through our COVID screening questions. Step 4. Get tested. Based on WA government requirements, you may be required to undergo a COVID test before surgery. This requirement can change as the Department of Health alert level changes. If required, we'll provide you directions. Step 5. Drop off and check in. Before entering the building, it's time to farewell any family member or companion that's brought you to hospital. This will help us comply with physical distancing requirements. With your permission, we can keep your nominated contact informed of your progress by phoning them when you've recovered from your surgery. From January 31st, the WA Government requires that all visitors to healthcare facilities show evidence of having double vaccinations. This includes to pick you up from our discharge lounge. Having said farewell to your family member or companion, it's time to start the check-in process, and you'll notice there's a number of stations that have been set up for your arrival. Firstly, check in by scanning our QR code in the Service WA app. Next, sanitise your hands and replace your mask with a hospital-issued mask. Finally, our staff will complete the process by taking your temperature and confirming that you're all checked in using the Service WA app. Step 6. You're good to go. And our staff member will concierge you to the hospital floor to be met by members of our administration and nursing teams who'll get you on your way. You are the centre of our care, and at all times it's our goal to make sure that you're treated with respect and dignity, and offer the opportunity to ask questions of every healthcare provider here at West Leederville Private Hospital. With our 6 steps to surgery, we aim to make your surgical journey as friendly, pleasant and COVID safe as possible.